So we're going to try to lift that scar right there. A little pinch.
No, I need a better angle. Adjusting next.
Go a little more. Lift it. It's a little bit on the edges.
About how this helps.
So this scar that he has is a chickenpox scar. It's a depressed scar. So the dermis and epidermis is thinned, and the depression causes a shadow that your eye sees. So what we're doing is we're thickening up that dermis, the skin where it's been thinned, by adding filler to it, and also to eliminate that sort of step off which causes the shadow. Sometimes you need to do it more than once, but you can see already it's much improved. There's still a little shadow right there. It's already much better than it was. Pinch.
Yeah, it does look really good.
There. So now you can see the shadow's more or less gone. The color is not, it's still a little bit lighter because that's just the color of the skin now. And that probably won't change, but right now he's also a little red from the other treatment around the edges. So once that the redness goes away, it'll blend much better. But often what will happen is this will settle, we'll take a look at it in a couple of weeks, and if some of that shadow comes back, meaning it thins out a little, we add a little more to boost it until it's nice and even. So you can usually get it corrected so it looks pretty darn close to perfect with filler like this. I'm going to treat this scar here. This scar was from a laceration. Basically, you said you fell and cut your face, correct? And it was repaired and then revised by a dermatologist. Now, I think what's happening, if you smile for me, give me a big smile. See, it indents a little bit, and that's because the deeper layer wasn't approximately put back together as well as it probably could have at the initial injury. So the skin is of course together, but the deeper layer is pulled apart, so it creates a little depression. So we're going to fill that depression with filler. Pinch. A little massage helps it distribute a little better. Okay, it's pretty much gone.
And it's gone.
No way.
So again, sometimes these need a little touch-up again just to make sure they look exactly the way you want them to, but it's pretty much gone. Okay, and then this last one right there, same idea, it's a little chickenpox scar. This one's, pinch, a little more delicate because the skin's there is thinner. So it usually doesn't take very much to achieve the result. So that one's going to be a little more difficult because the skin's so thin. It's already a little bit better. What I recommend to this one is we do that, let it heal a little bit and come back, maybe put a little more. Sometimes when it's in an area of very thin skin, a little dermabrasion is actually more effective, just because the difference is really minor. That's as far as I want to go today, just because it is close to the eye with thin skin. If you overdo it here, you'll see a bump very easily.